the data, right?
Yeah.
The data that we're seeing now is that 1 in 5 people of their reproductive years are expected to struggle with infertility. I personally challenge that label infertility because I think what is happening is that 1 in 5 are struggling with subfertility, and a lot of this can be reversed. And that's kind of where I want to begin, is with the optimistic, the hopeful response to that statistic is to refute the definition, because infertility sounds pretty damning and permanent,
Mhm.
and the idea then that you must immediately run off to an IVF doctor. And I have no qualms with IVF doctors, but before you do, make sure you're in as best optimal whole health and fertile health so you can get the best results. Now, some people don't have that luxury. If there's a diagnosis or surgery or something that needs to happen right away, they might need to go straight into an IVF cycle. But if you have even a month, ideally more, to clean up your physiology, your organ systems, your hormonal health, you're going to get better results.
Absolutely. I'll never forget there was someone I knew, I know she was trying to get pregnant, and she said, "Do you think I should stop smoking pot?" And I thought, "Oh my goodness." So that is the extreme, right? And you have to realize you want to have this amazing environment for this child to grow in the most optimal way and give it its best chance.
Exactly,
And
exactly. They're finding now microplastics in the follicular fluid. They're finding all of the inflammatory markers that are happening in, a person who wants to have a baby. If you are inflamed, your follicles are inflamed, and those eggs are growing in that fluid. That's the first nutrients that this egg is getting. So let's shift that, because it doesn't have to be that way.
so, what are the biggest threats, and why have these statistics gotten worse?
Yeah, environmental toxins would be my broad brush answer. You only have to go down an aisle in a particular box business, and you see shelves upon shelves upon shelves of toxic formulations, whether they be our hair care, our personal care, face wash, our makeup products, our personal cleaning products, some of our clothing or our bedding. All of these have been changed over the last 50, 70 years to be have extra, like, preservatives and chemicals that would either extend the life of them or somehow make our lives allegedly easier, but they are estrogen mimicking, they're hormone mimicking or hormone interrupting chemicals that we don't need. Really don't get any benefit out of sleeping on wrinkle resistant sheets. You know, but in so doing, or putting that dryer sheet in the dryer to make that bedding either smell better allegedly or be softer, means we're breathing in for hopefully 8 hours while we sleep
Mhm.
toxic chemicals.
Mm. And it's not just those chemicals that we hear about, but then what about the birth control? What about this, these girls, and maybe they're not even sexually active, but they're just trying to manage their period pain.
Yeah.
How is that going to affect fertility?
Yeah. Well, I mean, I mean no disregard to a prescribing physician, a gynecologist who simply wants to help, her patient in pain. But of course, it's masking what is causing the problem in the first place. And you're masking it sometimes for 20, 25 years. People come into my practice, or I talk with them, and they've been on oral contraceptives because they had acne at 16, and then they wanted to not get pregnant, so they've been on these oral contraceptives for a long time, and they have this expectancy that as soon as they stop, then everything returns to normal. But if you've interrupted hormonal communications for 25 years, the likelihood is it's going to take some time to get those communications back on board. And you have to deal with the original problem that created the problem back when you were 16 years old. So if you need immediate help, if a birth control, is going to get you sort of off the pain track temporarily, do so, but do so while taking care of the functional medicine inquiry that says, what's happening here? Because if what's happening here is that you've got fibroids or endometriosis or polycystic ovaries, they're not going to go away when you're on the birth control pill.